Thank you for inviting me to be part of this summit, and I'm very glad to share my thoughts with all of you. As we are in the midst of COVID-19 pandemic, more and more we recognize the need of partnerships, the need of collaboration, and need of working together. It is not new what I'm talking to you. If we look at the HIV/AIDS pandemic, if we look at the longest ever running pandemic in the history of mankind, that's cholera, all we need is to work together, because that is the only way to achieve success. We all operate in an ecosystem where each one of us has a role to play. So I'm drawing a simple analogy to the environment around us. We cannot exist in isolation. So it is not that we can put all the burden on the Ministry of Health or the health structure of the country. Civil society partners, individuals, all have to collaborate together to achieve success together. So maybe a few examples which have inspired me of late, which I would like to share with all of you, would give you some insights into some very interesting, innovative ways of working in future. The first one I want to quote is COVID-19India.org initiative. It's a crowd-funded initiative, an initiative which was at some point of time and is also today a point of reference for all of us to look at when we look at real-time data. It is one of the very beautiful way of using data intelligently in the organization, in the country, and trying to see how we can in real time make changes, adapt our strategies, adapt our ways of functioning around this pandemic. We see a lot of issues around COVID-19 that have come to the fore. It is not that these issues were not there, but some of the things that have actually accelerated out of COVID pandemic, few of them is strengthening of health structures. We have recognized that there is a need to further invest in health systems, and that needs to be not only done by the government, we need to have public-private partnerships there to engage on that one. The next one which is important is surveillance. I gave you this example of COVID-19India.org, but we also have to look at how do we engage with both public and private partners to get the data in real time to influence the health strategies and policies, and which are more connected to the ground realities. One other example where it is people coming together and organizations especially coming together is setting up of various teleconsultations with various helplines, be it mental health helplines, be it COVID helplines. So the burden is kind of mutually shared, and I think that is one of the strengths of collaboration. The onus is not on just one party in the country. The onus is shared mutually among both the citizens, civil society, and public health of the country. So COVID-19 has brought it to the fore that future preparedness is essential for us to deal with the challenges of today and tomorrow. And this can be only achieved if we work together. And working together and leveraging from transformational innovation, the dividend we have from the knowledge base we have in the country, bringing them all together, creating platforms for them to be able to bring the work to a level which is scalable, which is shareable, where people have access to that information, to transform that at the grassroots level. We want a future where we have public-private partnerships. We want a future where we have people more solution-oriented, and the solutions cannot come from one source. So we all have to work together to get the solutions of today, because without public, there is no public health. So a civil society plays a crucial role in bringing all this together, and platforms like Delhi Summit offers that space of exchange. Thank you.